Hi, I'm Dr. Howard Marshall, and on our first video, I explained to you what I'm out to do with my series of videos, which is to help you with your back pain. And I said that on my second video, I would go into some of the exercises. Let me just briefly again recap who I am and why I happen to be making these videos. I'm a practicing dentist who himself had some very severe back problems when I was in my 30s and 40s. I searched all over to get answers to them. The first acute episode I had was when I was shaving, and as I went down to wash the shaving cream off my face, my disc slipped, my back went out, and I was in acute pain. I dropped to the floor, I crawled into the living room, and I called a friend of mine who lived upstairs, and she came down and got me some ice to put on my back, and I wound up laying on that floor with the ice on 15-20 minutes on, 10 minutes off, 15-20 minutes on again, 10 minutes off, and this continued all day, all evening, and all throughout the night. And then the following morning, I went to see a chiropractor that a friend of mine referred me to. Through his help, I was able to start to get rid of the acute back pain, as he gave me a chop to my vertebra at C2, and he did some springing work with a device that you lay down on, and it springs, and through that your back discs move, and he got my L5-S1 back into position. Now, that was a terrible experience for me at the first time, and he did not explain anything about stretching and exercising, so it wasn't too long when I was back in his office with an acute problem again. And this went on and off for a few months. I was periodically back to see him, and finally I said, this is no way to live, and I've got to find other solutions. And I went to see other chiropractors. They each had their own style. Some were better, some were less good, less effective. And ultimately, in my researching, I also examined other methods that were available. And these methods included Rolfing, Reiki, Feldenkrais, far infrared, acupuncture, yoga, anything I could find on the internet that was of service or potential service. Ultimately, I found that none of them were particularly effective, at least not for me, and wasted a lot of time and money investigating them. And then ultimately, I got lucky. At the gym, I met somebody that was excellent at yoga instruction, and he said that he teaches people that are having bad backs how to do certain yoga exercises. And that was my big breakthrough. His name was Mark Turner, and I asked Mark to work with me, and after 3 exercises, I was back to walking completely normally again. And so, amazed, I said, would he be willing to make a series of videos to help other people? Mark said yes, and he enlisted the help of Sarah Delaney, who was another yoga instructor, and they were both therapists. And so together, they wound up creating a wonderful series of videos, 6 videos, each of which has multiple exercises, and it's progressive, so he starts with the easiest, and you go up to the more slightly difficult later. Nothing really difficult. So, created the videos, and then I wrote an ebook just recently that is soup to nuts, everything that you need to know about your back. Everything from nutrition to exercises to causes to solutions to how to prevent it in the future, and so on. And we also created a coaching program for people that want individual help, individual instruction, and created a membership program that will have the newest information that I come up with in the fields of nutrition, exercise, flexibility, and strengthening. Now, I promised that I would start to demonstrate some of the exercises to help you. So let's start showing you some of the most fundamental exercises to help your back when you're having problems. And these should be done on a maintenance basis literally every day. They're pretty simple. They don't take long to do. And if you start your day off with that, you're going to have a lot better day. So the first one I want to show you is where you're just plain standing and you stretch, called the good morning exercise, up to the ceiling as far as you can. You hold it for, 10-15 seconds, and then you come down. Simple as that. The next exercise, also very, very simple, is where you put your arms out and you gently turn side to side. Side to side, just very gentle. You can do this a few times, whatever feels comfortable to you, maybe 4 or 5 times, whatever you're most comfortable with. That's the second one, easy. The third one, you put a hand on your hip, open your legs up a little bit, put your arm above your head, and you just bend over, slide sideways as far as you comfortably can bend, and then you straighten out. Now I'm pretty senior, so I can't bend that far, but nevertheless, I do the exercise. So you just bend over as far as you can and get a good bend in your spine sideways. So that's the third exercise. Another one that's recommended that's very good, even to start with as a loosening exercise, even before the good morning stretch, is a simple exercise that will allow you to loosen your pelvis. And so you put your hands on the chair, legs slightly apart, and you just rock back and forth like this. You don't want to go too far forward, you don't want to go too far backward. It's just a gentle motion. And you do this maybe 30 or 40 times. I would say anywhere from half a minute to a minute. Okay? So that's a wonderful warming up exercise. Now, there are other exercises that we're going to teach you later where you might use a chair for support. But one of them that I'd like to show you now is where you raise one knee, and we want you holding a chair or a countertop, I like a chair, in order to get stability while you raise the knee. So let's say it's my left leg that I'm raising. I may put my hand out in front of me at a level I can reach, and I'm just going to raise the knee up and down like this. I'm going to do that about 10 times, and then I'll alternate with the other leg. So that's another very good exercise. So these are some of the warm-up exercises that are very helpful. There are exercises that we recommend for your buttocks and for the muscles on the side of the hip. One of them I can show you standing, but it's also done with a person when they're lying down, and that one looks like this. So in this exercise, what you're going to be doing is just raising your legs sideways, maybe about a foot. Doesn't have to be too far. Leg is comfortably straight. You can be a little slower than I'm doing. The slower you do it, the better it is. And when you finish with one side, you just reverse hands and you do the other side. I think these exercises I've just shown you are quite good as beginning exercises. So in our next video, and by the way, when Mark shows you the exercises on the videos in the bigger program, he goes through everything you'll need to know for the whole core muscles, the whole abdominal core, the side core, and the back core. Because the muscles that you're strengthening are completely 360 degrees around your trunk. They're not only in the front or on the side. So in our next video, which will be in another couple of days, we're going to go into some of the other supportive material that's quite critical for you in terms of your overall nutrition and how to repair. Because remember, what we're dealing with is weak muscles. We're dealing with a need for collagen and protein repair, and we're dealing with a need to get those muscles strong so that they can support the spine and prevent the vertebra from allowing a disc to slip out from in between the vertebra. All of that is from the muscles holding the vertebra in position. So in our next exercise, we're going to go into the nutrition aspect of things and how you can rebuild. And if you happen to be overweight, there'll be a lot of tips for you in terms of how to easily lose weight with almost no effort and achieve the results you want to. So till next time, Dr. Marshall here, and our website is backpainhelp.us, backpainhelp.us, and I look forward to seeing you in 2 days for the next video.